We're seeing currently is that cases of COVID are going up, and it's mainly in the northwest portion of the state and the southern part of the state. But the cases are going up in Chicago and Cook County as well. But we don't have specific data for Illinois, but we know that nationally, that the people that are getting infected are people who aren't vaccinated. In fact, the number of people who are not vaccinated are 6 to 7 times more likely to get infected than people who are vaccinated. And chances of dying from COVID are about 12 times higher if you're not vaccinated compared to if you are vaccinated. So it is still primarily an infection of people who are not vaccinated. Breakthrough infections do occur. We expect them to occur. No vaccine is 100% effective, and we do expect to see breakthrough infections. And as immunity wanes from the vaccine, we will see people get infected. That's the reason for the boosters. But the main reason to get vaccinated is that vaccination decreases the risk of serious infection, decreases the risk of hospitalization, decreases your risk of dying, and also pretty good evidence that it decreases the chance of transmitting to other people. If you do get a breakthrough infection, again, whether you've been vaccinated or had COVID in the past, you can still transmit the virus to other people. In general, being outside is safer than being inside. Obviously, that's not practical in Chicago in the winter, so a lot of people will be indoors. And what's important is what's the ventilation in the indoor space and how many people are there. So the more people there are, the less the ventilation capabilities of the building, the more dangerous it is. So that is why it's strongly recommended and currently mandated that if you're indoors in a public area, you have to wear a mask. As we approach the holidays, things that you need to consider are whether or not you want people there who aren't vaccinated, and how much risk are you willing to take by inviting someone who hasn't been vaccinated. And that's an individual decision that you'll have to make on your own, and your family has to decide. If there's someone in the family who's immunocompromised or older, and if they do get infected, whether vaccinated or not, they're more likely to get a serious infection and end up in the hospital or possibly die, you may want to be stricter about whether or not you want an unvaccinated person at your family gathering. Some people might also consider having people get tested 1 or 2 days before the gathering to make sure to decrease the risk of transmission. It's not a guarantee, because a negative test doesn't mean that you won't be positive 1 or 2 days later, but it'll decrease the chance that someone's infected, and it's another layer of protection.